Well, New York Governor Andrew Cuomo caught up in multiple controversies over his handling of the coronavirus. And now a new report says he's also facing an exodus of his top health officials. 9 of them quitting so far, claiming morale in the department is at an all-time low. Joining me now is New York City Councilman Joe Borelli. And Joe, this report in the New York Times says that among the people who departed, the Deputy Commissioner for Public Health, the Director of Communicable Disease Control, the Medical Director for Epidemiology, the state epidemiologist, all saying that they were sidelined, disrespected by the governor and his policies. What's going on here?
Well, John, if this isn't the siren song for my fellow New Yorkers, I don't know what is. And in my opinion, the governor needs to think about stepping aside. Look at the totality. We had this nursing home order expose last week by the Attorney General. The cover-up was exposed. Now we have the evidence that he sidelined his own health department on the vaccine rollout in favor of the Greater New York Hospital Association, which, for those that don't know, is one of Albany's biggest lobbying groups, one of his biggest donor groups. And then again, the totality, all this while whether it's vaccines or deaths or the state's budget deficit, the economy, unemployment, this is a governor who has led the worst response in the United States of America. I think it's time for him to really think about heading down the thruway one final time.
This is another thing that was covered in the New York Times story, this idea of Cuomo not using state health department developed vaccination plans, that he went his own way on this on Friday in that press conference. He said he doesn't trust the experts revising rules and guidelines without consulting the health department. Did the governor know more than the health department did?
No, and it's just insane to think about that. Even early on when we started the vaccine rollouts, we heard from county executives, from even Mayor de Blasio, from a bunch of local health leaders that said they had worked long and hard on plans with the State Department of Health on vaccine rollouts. It went to pot. It didn't go very well. And now we find out that the governor actually sidelined his own people. I mean, these are the kind of things that really need accountability. And in my opinion, the state legislature has to immediately convene some hearings and get to the bottom of it.
On the other front, that Cuomo is facing a lot of opposition and criticism on the nursing homes and putting patients who were COVID positive back into nursing homes that were not equipped to handle them. New York Congresswoman Elise Stefanik saying that there needs to be a DOJ investigation. Listen to what she said.
I am calling on the Democratic state senators as well as the Republican state senators to immediately issue those subpoenas and the Department of Justice to issue those subpoenas. I'm also calling on President Biden to publicly state that there will be an independent investigation and not play politics with this.
Joe, what do you think? Does there need to be, at the very least, a congressional investigation here, if not a criminal investigation?
Sure, the Congresswoman is totally right. And again, it was the state's Democratic Attorney General who really threw the floodgates open on this. New Yorkers and anyone are really willing to give a little leeway to a governor who acted in the best interest and maybe made some mistakes. But that's not what we had here in New York. We had a governor making bad policy that killed many people. And then he tried to deliberately avoid sharing that evidence with New Yorkers and the world for months. So this is an unforgivable offense at this point. It's not just bad policy, it's a bad person.
As you probably know, Joe, our own Janice Dean lost both of her in-laws to coronavirus in nursing homes. Here's what she said about the need for an investigation.
I want a full bipartisan investigation with subpoena power. I believe this could be criminal, and we need to see the governor and his health commissioner in a court of law to tell the truth, the whole truth, and nothing but the truth.
The governor insists that he was following CDC guidelines, but both Alex Azar, the former Secretary of Health, and his deputy, Brett Giroir, have said that's not true. He wasn't following the guidelines to the letter.
Yeah, I mean, it seems to be the first indicator of a policy or a series of policies where he didn't listen to the health experts. It's tough to ignore the fact that if this was Donald Trump, or when it was Donald Trump and he was being criticized for not following advice, the media piled on him. Yet the media in New York, swoons over this governor like he's a teenage pop idol. And it's been a little sickening at some points. But I'm glad finally, whether it's the Times or other news outlets, they're finally starting to pick up that this guy is not all he seems.
And we'll see where it goes. Joe Borelli, New York City Councilman, good to see you today. Thanks so much.